Good afternoon, everybody. Let's see, got a slide up here. Great. So we're here to talk about dependent eligibility auditing and BMI audit services. Tom, thanks for the great introduction, and thanks for putting on such a tremendous conference. Hope it didn't sound like I just wandered in off the street, since Tom didn't know who I was, but somebody showed up with some information about dependent eligibility auditing, so here I am. So this is my fire alarm slide, and what that means is if the fire alarm rings in 5 minutes and we have to leave, these are the things I want you to be aware of. So BMI Audit Services, we're established, we're a 16-year-old firm, we're independent, auditing health benefit plans on behalf of plan sponsors is all we do. And we are health benefit audit specialists. We are the definition of narrow and deep. We don't do any other type of auditing, and we have no other ancillary businesses. As far as dependent eligibility audits, I'm here to tell you, dependent eligibility audits are absolutely the low-hanging fruit of cost containment and risk management for your clients. Guaranteed savings in many cases, and we've always seen, with one exception, a high ROI. We found one small employer that had 100% of their dependents verified. But other than that, the savings and the returns on investment have been nothing short of magnificent. If you're a broker, you should consider offering a dependent eligibility audit to every one of your clients. And the reason we say that is there's several reasons backing that up, and they are cost containment, they are risk management, and if there's a great idea out on the street, I'm sure you want your clients to hear about it from you first. If they hear about it from a competitor who might have a similar idea, that high ground of intellectual capital has been dissipated by offering what has become a Me Too service. And there are very few other services that the phrase "an ounce of prevention is worth a pound of cure" really relates to as much as a dependent eligibility audit. And then BMI offers high-value features as standard for which other firms charge extra. I guess if there was a headline to go along with this presentation, it would be verify plan compliance, reduce costs, reduce risk, become a rock star. No, not the rock star part, but the other parts are exactly on the money. And then we offer some additional resources. We offer a piece that we offer monthly called Audit Finding of the Month, and we offer a book of business analysis service, which will help you triage the best opportunities of all those clients that you work with to identify the best ones to offer dependent eligibility audits to first. So, jumping into the presentation, a little bit about BMI. Founded in 1998. We're based in South Bend, Indiana, with offices on both the East and West Coasts. The nerve center of everything we do is our proprietary auditing platform called Audit IQ. It was developed internally by our staff, led by Jim Matthews, partner in the firm, who is joining me here today. He's over at our table. It is basically a relational database on steroids that's been optimized for auditing health benefit plans. Let me hear it from the crowd. Ooh, no excitement around auditing health benefit plans? Okay. Well, the results are pretty exciting, as you'll see in a little while here. So we offer comprehensive audit solutions. We offer claims audits, medical, prescription drug, dental, vision, as well as dependent eligibility audits, with several different variations on those dependent audits. So the comprehensive audit is the main one I'll be talking about today. But we also offer affidavit-only audits that are more applicable for different types of work groups that might not be quite pencil and paper type of people, people that are working out on road crews or on oil rigs or that type of thing. We offer working spouse verifications as well as ongoing audits. And then some other customized benefit-related audit services as well. We've got a few slides here about BMI that this is our Boy Scout law, trustworthy, loyal, helpful, friendly, courteous, kind. But let me get through this stuff. This is useful. What our clients have to say. Our clients are extraordinarily happy with our dependent eligibility audit services, as some of these comments reflect. I like the middle one that says, your staff, especially our project manager, was always so helpful and I enjoyed working with them. In general, our clients find our dependent eligibility audit service in particular easy to work with. And then we provide innovation, and let's talk more about the actual benefits of a dependent eligibility audit. I'd like you to focus on the two top bullet points. So contain the growth of overall healthcare costs and limit the risks. So those are the two big reasons to conduct or consider conducting or to promote to your clients that they conduct a dependent eligibility audit. So who is at risk? So in our view, every employer is at risk, and there is really a perfect storm of factors that you might not even be aware of that is affecting the dependent eligibility of your plans or your client's plans. And the first one is the legal and regulatory changes. So of course everybody knows that under Affordable Care Act, the upper limit of eligibility for dependents is changed to 26 for medical plans. So no longer do they have to be only 18 or prove that they're a student. So that expansion of that class has greatly increased the cost of dependents. And then we've also lost the ability to exclude dependents for a variety of different types of situations. Things like needing to reside with the employee. You can't require that anymore. There's no more marriage prohibition. There's no more full-time student requirement. So basically, the floodgates have been thrown wide open for a whole group of people that were never qualified to be dependents before to be dependents now. In fact, in some states, like Massachusetts, they even require plans to cover former spouses. Former spouses need to be covered until they've got coverage under from somebody else's health plan. So if you have Massachusetts employees, beware. Oops, excuse me. So next we have the real changes that I came to talk about. So the first one I'm calling, for lack of a better term, the new American family. So what am I talking about here? Well, American households look very, very different than they did demographically 20 or 30 years ago. So what's going on? We've got unwed parents. It definitely seems like marriage has completely been optional. There's a term in society called baby mama, which never used to exist. It used to always be wife, and I don't understand why that is now. But it seems like there is just not as much connection any longer between having children and being married. So you've got a very fragmented type of household. Demographers used to call it the nuclear family, and now they call it the patchwork family. So we've got the effects of multiple divorces. I was talking to somebody at the conference here earlier, and they're talking about their employee being on their third marriage, or actually I think they said their third divorce. So there's definitely a stream of non-traditional relationships that are left behind events like that. And then finally we find on the plan the grandchildren's, nieces, and nephews. So we've really got all kinds of unintended and unexpected situations that we're finding in these households. Next, we have high unemployment and new employee relationships. So the news about unemployment rate being high isn't really, I guess, news per se. But I was reminded of it just a couple of months ago when I heard that interest rates would stay low until the unemployment rate went below 7.5% again, which just reminded me how high the unemployment rate is. I've heard that in certain parts of the country, it's even double that. So the effect of that high unemployment rate is that those are people who would otherwise have had their own benefits. They're part of these non-traditional households, so they are the part of the unwed couple, and they are basically the ineligible dependents that are going to show up on your plan or your client's plans. Similarly, these new employee relationships, I've got new in quotes because in the old days, there wasn't really a lot of people that were in non-benefits eligible employment roles, except for a couple of isolated types of industries, hospitality workers perhaps. But for the most part, there were people who were employed full-time, covered by their benefits. After they retired, maybe they'd come back for a short stint, a year or two, as independent consultants, not covered by benefits, and that would be the extent of it. Now it seems like there is a layer of the workforce that's designed specifically to be non-benefits eligible because they're more cost-effective employees. And guess what? Those are also the people that will show up as your ineligible dependents on your plan or your client's plans. And then finally, the rising cost of health care. And when I've seen that phrase before, I've always thought of it as the effect it has on the plan sponsor themselves. But here it's written as affecting the uninsured individual. So while we're all looking at what the cost of health care is in terms of the costs that flow through health benefit plans that generally get the discount of the networks that they're part of, these uninsured individuals are subject to the charge master rates, if you will, of hospitals that may have been increasing dramatically. And all of a sudden, that they're hit with bills for everyday occurrences that could easily bankrupt them. I had an appendectomy 2.5 years ago, and I had an $80,000 bill before the hospital discounts. And I'm sure many people in this room have similar stories of hospital confinements that had huge price tags associated with them before the network discounts were applied. So what happens? It just raises the ante for those people who don't have insurance elsewhere to be covered in any way that they possibly can be. So what factors are supporting this trend? Well, we've got distributed workforces and telecommuting. I've had parts of this conversation with a lot of people in this room, but in the old days, there used to be someone that, for better or worse, might have been termed the office mom, who knew everybody's story. And the workforce was all pretty much in one or two concentrated locations. And I've met this person on a number of occasions where they know what's on the high claims report before they even see it. They know who's gallbladder, they know who's having the baby, they know who's got the broken arm. But as the workforces, like the families, have become more fragmented, there's less of that. And there's almost a sense that we don't really want to know. We don't really want to be too involved in our employees' business. But that's part of that fragmentation that allows this ineligible dependents to kind of come onto these plans. So, excuse me. Self-service enrollment systems often don't have the checks and balances implemented to control who's being signed on. So if you can sign on, enroll in your plan whoever you want to, perhaps sitting in your bedroom slippers at home on your laptop computer, there's less of a barrier to feeling that you can't enroll those people that you shouldn't. And finally, passive enrollment systems. So those passive enrollment systems are those systems that would not require an active enrollment of everybody to renew their benefits, and would allow people whose benefits eligibility may have lapsed to remain on the plan. Perhaps those are divorced spouses, perhaps they're children that are now full-time active duty military, whatever the case might be. And who are the high-risk employers that we see? Well, government plans, and this can be state and local government as well as county government, healthcare, on hospitals, manufacturing environments, and organizations built via acquisition, where there's one more step of removal between the employee and the plan sponsor. So what are the sources of potential savings? Well, we've got the obvious one is the avoided future claims expense. Now, it's worthwhile noting here that I've got the word future up there. Very few of the plan sponsors that we work with have actually been interested in going back and trying to reclaim retrospectively the claims expense that these ineligible dependents have incurred. So they're really just looking to the future. Now, when we bring somebody off the plan by the employer that we've worked with, terminating them, that means that that individual is not available to incur plans the next year or the year after that. So there's really an annuity effect that can affect the long-term trend of the health benefit costs. And that kind of bends the trend. So this is obviously the easiest factor to quantify. So next we have the employer's premium subsidy reduction. So the employer's premium subsidy reduction is a factor that relates to a multiple tier enrollment system where there is an employer subsidy of a progressive amount as you go up to the higher, more expensive tiers. So if the employer offers either an absolute dollar greater amount of subsidy or a percentage higher absolute amount of subsidy, then by moving a family group from one tier down to the next tier, they're actually going to be able to reduce the amount of subsidy that they're paying. And now this is effective for both insured plans and self-insured plans. But for insured plans in particular, that's a real cash saving. So there's an actual premium check that's going to go out the door every renewal period or every premium period, where that's going to actually be less money because it's going to reduce the amount of the employer's contribution. And then finally, the avoided risk of an ineligible stop-loss claim. And this is absolutely the kind of the top reason to conduct a dependent eligibility audit. The current cash flow savings is a great bonus, but the idea that you can actually avoid the risk of an ineligible stop-loss claim is just huge and way out of proportion to the cost that this audit might have. So it's a terrific benefit and one that you should bring to all your clients. So I'm going to continue on with a couple of examples. So here we have a small employer. It happened to be a beer distributorship, Galveston, Texas. And it's an interesting story. They were dead set. They were absolutely sure that they had no ineligible dependents on their plan. They felt that they had a very, very strong bond with their employee group, that they would do anything for their employee group, and their employee group were all stand-up people that would do anything for them. And they would never put a knife in their back by having an ineligible dependent on the plan. Well, what happened here, we started out with 156 employees covering 341 dependents. We had a really good response rate of the audit, 91.7%. And we assumed going in that there'd be an average annual cost per dependent of about $3,000. And that $3,000 to $3,500 is what we typically see as an average. And we expected that there would be a range of 2 to 10% of total dependents being ineligible. Well, as a result of that, we expected to have savings of perhaps $20,400 up to maybe $102,000. The actual results of the audit were that we had 10 failed dependents, and failed means that they provided all the information we asked for, but it proved to us conclusively that they were not eligible for benefits. 15 incomplete, So they didn't provide all the information we asked for, or they didn't take the, they didn't sign the form to attest to the truthfulness of what they were providing us. And 14 people didn't respond at all, for a total of 39. So the first year savings at $3,000 per year was $117,000 from this employer that thought that they wouldn't find a nickel's worth of savings from this dependent eligibility audit. Now, this employer was incensed. They said that they couldn't believe that they had all these people that were either incomplete or non-respondent, because that was just totally unacceptable to them. And they were going to get toe-to-toe with these individuals and get up in their grills and figure out what it was that was preventing them from responding to these audits. Well, weeks passed, and the audit ended, and this is what we found. So there was no further response. And you know, a lot of these people are just, were in the boat of saying, you got me. I've got some ineligible dependents on the plan. I'm not going to have any part in you removing them any sooner than necessary. And guess what? They took their couple of weeks to get all their prescriptions refilled, get their teeth cleaned, maybe get a new set of glasses, and get the last bite of the apple. But they finally got them off the plan. So this particular project cost about $6,600 for $117,000 worth of first-year savings. And the first-year ROI was over 1,600%. Needless to say, the broker that brought this to their attention saw it as a huge home run, and it really enhanced his relationship with his client. Next, we have a slightly larger employer in a different industry. So we have a supermarket chain with 196 employees covering 408 dependents. This is the white collar section of this employer because the rank and file were in a union. The employer wanted to be at arm's length, didn't really want to be involved in carrying the audit forward, just said, BMI, you take care of it, we don't want to know. So it does reflect in the response rate of 87%. We kind of look at 90% as the line of what's kind of acceptable versus and good versus kind of below standard. Here we expected with the same assumptions as in the last slide that we would have savings ranging from 24,000 to around 122,000. And what we found was that we had 53 fails and first-year savings of almost $160,000 on a project that cost just over $10,000 for first-year return on investment of 1,488%. Sure. We're only projecting the potential claims cost at $3,000 annual average cost per dependent. Not the premium, no. No. Any other questions since I'm going through this? No? And then thirdly, we have a larger group. This is a labor union retirees fund. It was actually a police and fire retirees fund. And here we have 1,262 employees covering 1,628 dependents. Now, this was an interesting group because they had a rule that said that they would only provide coverage for the spouse that you retire with. So if you decided to divorce afterwards, there was going to be no coverage for your replacement spouse. So as a result of this, we had the trustees were composed of a good part of active duty police and fire who were contributing to this fund, but the current retirees were spending the money. So they wanted to make sure that the money that they were contributing was going to be around for when they retired. So they really wanted to make sure that the money was being, spent according to the rules of the plan. So in this case, they had a 94% response rate. They knew they had just done an actuarial study, and so we used a slightly higher average annual cost per dependent of $3,509. But the amount of ineligible dependents we found was really significant. So when you add up all those different categories I had enumerated before, the failed, incompletes, and no responses, they had 182 ineligible dependents. And as a result of that, had first-year savings of over $638,000 on a project that cost just over $30,000. So the return of investment was almost 2,000% at 1,987%. So again, a very, very significant finding. So with those examples behind us, what should be considered in a dependent eligibility audit? Certainly the tone of the audit is going to be very important. A lot of employers are concerned that there's going to be a lot of pushback from employees. And there could be. And there could be in a variety of different ways. But like a lot of things in life, this is one of those where it's not as much what you say as how you say it that can really count. If you take a very pejorative tone and tell your employees that we don't trust you any further than we can throw you, and we're going to make you prove your ineligible dependents or prove your dependents are eligible, yeah, you're going to get a really adverse reaction. But if you say, hey, we're all in this together, and every dollar spent on an ineligible dependent is a dollar that all the eligible plan participants don't have available to them, there can be a little bit more, maybe that's the basis for a little bit more understanding. Another thing we should look at is the timeline. So does your client have a long timeline for this, or are they right up against their renewal window? And we should look at the termination procedures, and the word legal counsel's up there because what we're suggesting is that you think through how this process ends before you start it. So that if the intention is to remove your ineligible dependents, it might be a good idea to bring senior management or the leadership team on board so that there's not a big surprise at the end when a list of ineligible dependents are generated for benefit termination. And then retrospective versus prospective, as I mentioned earlier on, most of the time employers are just looking at prospective savings. So the idea is to get your ineligible dependents off the plan to avoid costs that they would incur tomorrow and afterwards. And then some of the resources that you should look for in a provider. The communications would be very important, and how you can have those communications tailored to your benefits philosophy. And also, what kind of resources are available behind the scene? So what kind of software is available? Is it a simple database like an Excel? Or is it more of a relational database that might be based on SQL Server? And in this case, BMI happens to be particularly fortunate that Jim Matthews and his team have put together a segment of our Audit IQ suite of audit tools specifically designed for dependent eligibility auditing. And we look at not only the adjudication part of that software, but the reporting capabilities and whether they're HIPAA compliant or not. Another big important part of these types of dependent eligibility audit campaigns is the availability of resources to respond to the clients or the employees in a timely way. And a call center is one of the key resources that they have. So looking at the call center, is it in-house or outsourced? There should be a multiple line toll-free phone system available. Are there fax and email options? And again, is it HIPAA compliant? So I'm going to jump around just a little bit here. So what are some of the kind of the real world considerations that go along with these dependent eligibility audits? One of them is that, in fact, in talking to some of the employers and brokers in the crowd here, I've heard them say that their plan might be too small to do a dependent eligibility audit. Well, I'd suggest that a dependent eligibility audit is perhaps more important for a small self-insured plan than perhaps even more so than for that of a large employer. In the case of a small plan, if an ineligible stop-loss claim should occur, an unbudgeted and unplanned for $400,000, $500,000, $600,000 or more, and we heard the litany of what types of circumstances could generate those from our stop-loss friends here just yesterday, whether it's a preemie baby, an auto wreck, or was it an expensive Hep C drug we were talking about? You know, any one of those can generate all kinds of unanticipated costs. And for a large employer that's got lots of financial resources behind it, cash flow, that they can maybe handle that. It would be a financial inconvenience. But for a small employer that might have 50 employees, a cost like that could be a game changer, and not in a good way for that type of employer. So I'd suggest that a small employer should definitely consider a dependent eligibility audit, even if it turns out not to be the thing for you right now. You should consider it and kind of run it through. Another aspect of dependent eligibility audits is including multiple coverages. So a lot of times employers will say, well, look, as long as we're doing a dependent eligibility audit for our medical plan, let's include our dental coverage as well. Well, that dental coverage might not be covered by Obamacare, and it might be under the old criteria. So we can easily bring in the plan criteria of that other plan, an enrollment file for that other plan, realize that there might be some dental-only households that might slightly increase the cost of the audit to cover those additional subscribers, but that can be included as well. And then we also had wanted to circle back to a couple of the variations that we had. So last summer, United Parcel Service made a big splash by announcing that they were going to remove something on the order of 15,000 spouses, if I recall, by having a spousal exclusion to their plan. And many employers added that kind of spousal exclusion if the spouse is employed and has its own benefits, his or her own benefits available, in the last renewal at the end of the year. So BMI offers some specific technology and techniques to verify that spouses do not have their own benefits available, and to document it if they do. So that's that's one of those things that you want to look at as well. So I'm going to skip ahead just a few slides, and I want to get to one at the end here. So just some audit recommendations. Would definitely recommend that your clients read their summary plan descriptions closely for the dependent eligibility audit criteria. A lot of times we find that the plan sponsor isn't really familiar with what's actually in that SPD. They may have had an administrative procedure that was running administering their plan criteria one way, but it might be out of sync with the criteria that are written in their plan. Similarly, you may have different criteria that really are not synchronized with each other between different types of coverages. So your medical and your dental may not quite look like they line up exactly to reflect the benefit intent. Next, as I mentioned, gain the company leadership's approval of the project early before starting the wheels in motion. And if the company has a unionized workforce, to provide union leadership with advance notice so they can get their approvals out to their ranks. So if the timing is towards the end of the plan year, we suggest using an open enrollment period as a passive amnesty. So amnesty is one of those topics that you may have heard of mentioned in relation to dependent eligibility audits. We found those really used more 3 and 4 years ago, because what we sensed was happening was that if you offer an amnesty period where there's no consequences for people to come forward to remove their ineligible dependents, there almost feels like there needs to be some consequences if they don't take advantage of the amnesty period and they come forward later. But as we talked to our clients about it, what we realized is that they'd be happy for them to remove their ineligible dependents at any point in that audit timeline. So rather than having an amnesty period that unintentionally, after it's over, might drive those people with ineligible dependents more underground, we've just incorporated that amnesty into their verification process by adding a checkbox that says, my dependent is not any of the above listed. So it makes it very easy. It gives them an easy off-ramp. And what it avoids is kind of the Achilles heel of these types of projects, which can be the number of ineligible dependent, the number of no responses at the end, because we don't know why those people didn't respond. So by not just casting them off and almost forcing them not to respond if they didn't take advantage of that amnesty period, we give them that easy off-ramp. And then finally, confirm home addresses and any other information plan sponsors may elect to use during the audit early on, before the project starts, so that we have an opportunity to have the initial mailing be as effective as possible. So those are kind of the who, what, where, and why. But I want to take just a couple of minutes to talk about the how we go about this. So I'm going to jump back here, talk a little bit about BMI's process. Oh, here we are. So our dependent eligibility audit process starts with a planning process. So we would typically have 3 weeks of planning. We use an audit process guide. It's a very brief intake questionnaire. We set up the employee web portals, which is a behind-the-scenes tool that is used to securely pass information back and forth. We'll obtain eligibility rules from the plan documents. And during a planning meeting, we'll confirm eligibility rules, customize first drafts of the materials, and develop and confirm the timeline. And we really run these projects very closely by the project timeline. So when we talk about a timeline, we mean that we pretty much bring this right down to, we're going to have a first mailing of 4 weeks, wait a week, then a second mailing of 3 weeks for a verification period, and then a third mailing, and then we're going to be done by the end of that process. So that allows the plan sponsor to know exactly where they are in that process and what's next all the time. So during the audit setup, we'll actually import the enrollment data and run it through extensive checklists to make sure that we have good quality data on which to base the rest of our project. So it's not unusual for us to find alpha characters where there should be a numeric-only field. It's not unusual to find syntax coding that might mess up a mailing. So we'll stress all those things, as well as checking employee ID, relationship, date of birth, making sure there's only one spouse per subscriber, that kind of stuff, one to a customer. We will we'll set up a unique family dependent ID, and then we'll get into our process. So this serpentine chart actually gives you how we set up the audit. So the blue box in the upper right-hand corner there is our planning phase for about 3 weeks. And then, as you can see, we have 3 distinct mailing phases. So our paradigm here is that the laggards, the people that we're most concerned about bringing along in the audit process, often don't get going until they're already late. So we make them late as early in the process as possible. So here, if they don't reply at the end of that first mailing, we wait a week for the mail to clear for any late respondents, and then we send them an extension letter that says the audit's over and you missed it. but please take advantage of this extension period that's available to you to preserve your dependent's benefits eligibility. So that part will last 3 weeks, as I mentioned earlier. And then we get down to the third mailing. And the third mailing is a little bit different because we take a much sterner tone with it. In fact, some employers prefer that we put a title on the top of it saying benefit cancellation notice or benefit termination notice. Now, it's not a benefit termination notice, but if that's what it takes to get some people's attention, the end somewhat justifies the means. And that letter will say, the audit's over and you missed it. You failed to take advantage of the extension period. At this point, we need the documents detailed on the attached form by X date, or your not yet verified dependents will be subject to termination by Y date. Now, the wording of that last part there is variable, depending on whether you say they may be terminated or will be terminated. But the point is that you've put out a final date. And that final date is meant to be in compliance with the 30-day period of notice before rescinding benefits. So by the time that final date arrives, the plan sponsor is actually in a position to drop the benefits coverage. And at that point, we will issue a final report, and they'll be able to make some decisions based on that. But during the audit, those red circles on the right are symbolizing our response mechanisms. So when we receive a complete response, we'll send out an acknowledgement postcard. When we receive an incomplete response, we'll follow up with an incomplete letter. Very brief letter, very concise, but listing by dependent what documents are still needed. And then that just continues down for all 3 mailings. Along with that kind of response mechanism, we have a extended hours toll-free phone line with live Spanish, English bilingual operators. We also offer a fully secure employee portal. And this portal is a multifunction secure website that allows them to access all the information that we've sent them, all the documents. So if the dog ate their homework and they need another copy of their verification form, they can download it from the web, sign it, and upload it back to us. It will provide them with a transaction history of everything that they receive from us and everything we receive from them. And we barcode our documents. So if they send back verification documents with their verification form that's barcoded, it'll immediately give them an acknowledgement on the website. Because we get a lot of phone calls saying, I just faxed you my documents. Can you confirm that you received them? Well, we might get 300 or 400 faxes a day. So the short answer is no, but we can in a day or so. But by using the barcode, it automatically associates those documents that we received with with the family folder on our system. And then we have a fax service, as well as every letter that goes out from BMI will include with it a pre-addressed postage-paid envelope for individuals to send documents back to us. So there are a lot of different ways for people to respond. This is a screenshot of what our auditors actually see. Every document is digitized, and any originals that we receive are stored. A lot of documents we receive come in digital form. So our auditors will actually review the documents on screen and verify that they are what they're purported to be, and check the box. And it's the computer system and the computer logic that actually does the adjudication, that verifies that they're eligible. So that means that that's consistent processing, accurate processing, and free of any biases. And this is just a screenshot of the incomplete letter and the postcard. So reporting is a very important part of the picture. We report the information that we provide to our clients on in a Excel workbook that we organize by tabs, so that it's very easy. By color coding the tabs, we're able to designate to the plan sponsors what information needs their immediate attention. So things like a mail return we need an updated address so that we can send out documents to the correct address, or an internal review. We'd also receive that kind of color coding on the tab. And then finally, we have our final reporting is just the history of what the audit has revealed. By the time that history report is issued, though, a lot of the management decisions have already been made. So so based on our final interim report, the plan sponsor would sit down and decide who's going to be terminated from the plan, decide how that's going to be communicated to them, whether they want BMI to send a benefit termination notice or whether they're going to handle that internally, and to what extent they want to use a post-audit appeals process that we make available at no additional charge. So that post-audit appeals process is a 4-week period where we will continue to receive documents. And this might be for people that didn't really understand what they were responding to or didn't feel that their adjudication gave them a fair shake. It might be for people that started late in the process, wrote away to a state authority to get documents that they needed duplicates of, and then they return it to us, but after the end of the audit, so we could take those into account. Or simply for those people that just kind of fell asleep on the audit, didn't respond when they should have, and finally got around to it. But it's much more important for them, or it's much better for them to respond even in that late process than to wait for them to respond on their own time when they get that first denied claim notice, which might be 4 or 5 months down the road, and come running into the HR office waving their document saying, I'm eligible, put me back on the plan. What we're really trying to do is get all the employees to respond when they should in the span of the audit, rather than on their own to kind of give HR and benefits departments one more thing to worry about. Yes. Yep. Thanks. Thanks. So we're just winding this down. So then finally, we would review the findings in depth with the client and the consultant, discuss scenarios of all potential actions based on the audit results. So depending on what they find, they might not want to pull the plug on some dependents right away. They might want to give them additional time. Consider offering an optional appeals process that we just talked about that handles these potential misunderstandings, late respondents, and late receipts. And then BMI will prepare a file of terminated dependents for easy communication back to the administrator. So that's kind of a review of our process and what we're about here.
Thanks.
Thank you very much.